So this is, you demonstrate this with the patient. So you tell them, if Phelan's test is this one. So you just say, put your fingers together like this, bring the backs of your hands together like this, and then drop your elbows. Keep your backs of your hands together. Back of the hands together.
So you just drop the elbows?
Just drop your elbows. And you feel it increase the stretch across the back, but it's increasing the pressure inside the carpal tunnel. And you hold it like that for 60 seconds.
I feel pressure, but I don't have any movement.
And I feel pressure, but I don't feel any tingling or anything like that. So the positive sign is the tingling or pain that's familiar to them. This reproduces their complaint if it's carpal tunnel. Okay? And then reverse Phelan's is just this. Okay? So we bring our hands together out in front of us about shoulder height, and then we drop our palms down like this, but we keep our palms together. Just like that. And you hold that for about 60 seconds. So one compresses the contents, the other stretches them. So you choose one or the other usually, and you'll get your positive sign or negative sign. You don't have to do them both or all three. Okay? So that's Phelan's and reverse Phelan's or the prayer sign. And then we've also got Tinel's. Is that the next one?
Yeah.
Okay. Tinel's is pretty straightforward as well. We take their limb, we let it rest like this, supported, so they come down into a little bit of extension just by gravity, pulling their hand down. That stretches out the contents of the tunnel. And then we come into that space right there, and as you do it obliquely like this, and you just tap like that. And with each tap, if there's pretty good inflammation in there, then with each tap we get a zing. And the distribution of the medium there. So that's a Tinel's. All right. What's next? Allen's, and that's the vascular test. So we have the individual put her hand up like this. I just want you to make a fist just as fast as you can. And she does that several times. Meanwhile, I'm getting into place. I know where I want to go, right? Okay, now hold your fist. Hold it. Okay, now open up your fist. You'll notice that her palm is white.
Mm-hmm.
And it should pink up. Does it?
Mm-hmm.
Okay. Have her do it again. Hold the fist. Okay. Open it up. It should pink up.
You didn't do it as fast that time.
Okay. So there may be some differences between the two. All right. So we're looking for 2 to 5 second refill. That'd be normal. But if it doesn't, or it takes a really long time, then we have some problems with vascular patency, and that's always a referral out to somebody who deals with blood vessels. Okay? You've got to be careful with some of these things like Raynaud syndrome. You know what that is?
Raynaud?
Raynaud's is essentially like a cold allergy, if you want to think of that. It's a very vasoreactive response, and it's painful. Yeah, so this is not a test for that. Okay? What else?
That was it. TFCC.
Yeah, TFCC is the last one. Okay. So TFCC load is pretty easy. Just usually grab them like this, like we're going to shake hands with them. Bring them out like this in an ulnar deviation, and just go straight through this way. Just like that, bump it a couple times like that. And if there's TFCC compression, injury, split, anything like that, each time that we bump it, there's pain. All right. Is that all of them then?
Mm-hmm.